Hello friends, my name is Iken Ojegbe from Easy Click to Excellence in Midwifery. Today we are going to start with menstrual disorders. Menstrual disorders are abnormal conditions some women experience during their menstrual cycle. There are so many types of menstrual disorders, which include amenorrhea, metrorrhagia, menorrhagia, dysmenorrhea, premenstrual syndrome, and others. Specifically, what I am going to share with you today is premenstrual syndrome. Premenstrual syndrome is a group of signs and symptoms that women experience during their menstrual cycle, typically between ovulation and menstruation. Usually, the signs and symptoms start from 1 or 2 weeks before menstruation. That is during secretory phase of menstrual cycle. These signs and symptoms could interfere with the woman's activity and sometimes could need medical intervention. Sometimes it could be severe or it could be complicated. In this case, it is called premenstrual dysphoric disorder. So we can actually say that premenstrual dysphoric disorder is a complication or a severe form of premenstrual syndrome. There are so many signs and symptoms women experience in this condition. The symptoms of premenstrual syndrome can be categorized into 4 domains, which include somatic symptoms, affective symptoms, behavioural symptoms, and cognitive symptoms. Somatic symptoms. These are symptoms that affect the woman's physical body. In most cases, it could affect so many organs of the system. These symptoms include mastalgia, which is known as breast pain or tenderness. It could also affect the gastrointestinal organs. When it affects the gastrointestinal organs, it will present with abdominal bloating, constipation, or even diarrhea. It could also affect the woman's skin. In this case, there will be flaring of acne, and as a result, the woman will frequently visit the mirror. It can also affect the musculoskeletal system, thereby causing joints and muscular pains. She could experience headache, body ache, and fatigue. The woman may gain weight related to fluid retention. In this case, she will observe swelling of the fingers, the feet, and ankles. She may also experience alcohol intolerance, thereby vomiting even at the sight of alcohol. Now, affective symptoms. These are signs and symptoms that affect the woman's emotions and feelings. The woman may be depressed, irritated, or easily provoked even when there is no reason to be angry. She could also experience mood swings, anxiety, feeling out of control, and crying spell. The behavioral symptoms. These are clinical manifestations that affect the woman's actions and behavior, and they include reduced interest in usual activities. The woman may also experience reduced appetite and could crave for certain foods. Sometimes she may withdraw from her loved ones, such as the husband, the siblings, or even the parent. She may also experience reduced libido. In this case, she will experience reduced desire for sex. Cognitive symptoms. These are clinical manifestations that affect the woman's learning ability and logical reasoning. In this case, the woman may experience poor concentration and sleep disturbances, known as insomnia. Sometimes these signs and symptoms may require medical intervention, but in the case of premenstrual dysphoric disorder, the woman will need immediate medical intervention. What happens is that in premenstrual dysphoric disorder, the signs and symptoms are severe. For example, the woman may experience lasting or prolonged irritability or anger that could affect others. Also, The woman may experience feelings of sadness and despair to the point that she may desire suicide. Causes of premenstrual syndrome. Majorly, there are 3 causes of premenstrual syndrome and premenstrual dysphoric disorder. These include cyclical changes in hormones, chemical changes in the brain, and depression. Now, cyclical changes in hormones. Due to hormonal fluctuations and instability, the woman may experience some signs and symptoms of premenstrual syndrome. But these signs and symptoms usually disappear few days after the commencement of menstruation, or if the woman becomes pregnant or enters menopause. Chemical changes in the brain. Fluctuations of serotonin in the brain play a crucial role in mood state of the woman. Insufficient amount of serotonin in the brain may contribute to premenstrual depression, fatigue, food craving, and sleep disturbances. Depression. Some women with severe premenstrual syndrome have undiagnosed depression. Diagnosis of premenstrual syndrome and premenstrual dysphoric disorder. This is usually done through history taking and physical examination to identify the signs and symptoms the woman presents. Unless in severe conditions, when some laboratory investigations may be conducted. The woman must have 5 or more symptoms of premenstrual dysphoric disorder, including 1 mood-related symptom, to diagnose premenstrual dysphoric disorder. Now, treatment of premenstrual syndrome and premenstrual dysphoric disorder. Treatment is usually dependent on the cause and the clinical manifestations. Because the woman may be anxious about her condition, there is need to give psychotherapy, that is, reassuring the woman. In this case, the husband, parents, or any other support person are advised to stay with her and encourage her. Because the woman may experience severe depression, antidepressants may be prescribed. The antidepressants usually prescribed are selective serotonin reuptake inhibitors. These include fluoxetine, paroxetine, and sertraline. These are drugs of choice for treating mood disorder in premenstrual syndrome, and they are usually taken daily for the treatment of severe premenstrual dysphoric disorder. Non-steroidal anti-inflammatory drugs. These drugs are analgesics used for relieving pains and other physical symptoms. These include ibuprofen, naproxen, and aspirin. They are used in treating symptoms such as cramps, breast tenderness, joint and muscle pains, headache, and body ache. Another treatment measure is the use of hormonal contraceptives such as birth control pills containing drospirenone and ethinyl estradiol. These drugs stop ovulation from taking place, thereby providing relief from symptoms of premenstrual syndrome. The next treatment measure is stress management, such as relaxation techniques and engaging in activities she enjoys. These relaxation techniques help to reduce the effects of stress on the woman's mind and body. Relaxation techniques include deep breathing, massage, meditation, use of music, and art therapy. Another treatment measure the woman can employ is engaging in regular exercise, because exercising 3 to 5 times each week could help her cope with the symptoms of premenstrual syndrome. Eating adequate diets that include whole grain, fruits, and vegetables can help boost the woman's immunity.
It is also important that the woman decrease her salt, sugar, caffeine, and alcohol intake, which could aggravate the symptoms. The woman is also encouraged to take adequate sleep and rest to help her relax and regain her strength, especially when she is fatigued. The use of diuretics. When exercise and dietary restrictions are not efficient in reducing weight gain, swelling, and bloating that occur in premenstrual syndrome, diuretics such as spironolactone could be prescribed to help excrete excess fluid through the renal system. The treatment measures for premenstrual syndrome include psychotherapy, the use of antidepressants, the use of non-steroidal anti-inflammatory drugs, hormonal contraceptives, stress management, exercise, nutrition, sleep and rest, and diuretics. Usually, the signs and symptoms start from 1 to 2 weeks before menstruation. These signs and symptoms could interfere with the woman's activities and sometimes may require medical interventions. Note that the treatment measures discussed in this video do not replace seeking for medical care from a qualified healthcare professional. Thank you for watching our video. Remember to like our video, subscribe to our channel, and hit the notification bell so that when we release a new video, you'll be the first to see it. Also, remember to put your comments in the comment section below.